we're very fortunate in CLL now that we have many different effective therapy options for our patients. And for older, frailer CLL patients, we don't necessarily need to use aggressive multi-agent regimens. We might be able to put them on a novel agent drug and they can do well for several years. But our study focuses on a different group. It's a patient population that tends to be younger, typically age 65 or less, a fit population that can tolerate a more aggressive treatment approach. And for many of these patients, they like the idea of having a combination approach that can be time limited and may actually have curative potential for CLL. So the aim of our Ibrutinib FCR study is to build on the experience of FCR alone, which has already been shown to have curative potential for patients with low-risk forms of CLL, like the mutated IGHV. In our study, we include patients with mutated IGHV and also patients with unmutated IGHV, which is historically a more high-risk form of CLL, where we don't typically see a durable benefit with FCR. But we know that Ibrutinib is very effective for patients with unmutated CLL. So what we do in our study is combine Ibrutinib with FCR for up to 6 months, and then we tail that with 2 years of Ibrutinib maintenance therapy. And we include patients who are fit, age 65 or younger, and previously untreated. What we're going to present at the ASH meeting in an oral presentation is the results on the first 35 patients of this trial. We've seen that the drugs are combining very nicely in terms of the side effects. We don't tend to see any additional side effects compared to what we'd expect from either regimen alone. But what we're seeing actually is dramatically higher rates of complete remission, and in particular with MRD, or minimal residual disease negativity. So typically with CLL patients who get FCR alone, we see about a 20% rate of CR with MRD negativity. In our study so far, we've seen nearly a doubling of that rate at 37% at the time of initial evaluation after the combination. But what's been more striking in our study is that when we continue the patients on the Ibrutinib maintenance, we see a deepening of response over time, such that if you look at the rate of best bone marrow MRD negativity, we've reached 83%, which is the highest rate we've seen in any regimen in CLL to date. So we're optimistic that a substantial fraction of these patients, even including the patients with unmutated IGHV, are going to have durable response, potentially even cure. And we think that this type of regimen, even though for a smaller subset of CLL patients, will be a valuable addition to the armamentarium of therapies we have for CLL.